Hello, my name is Lance Randall, and I'm a general dentist in Roseburg, Oregon. And I'm a 6'6", 7'2", and this is my story. I was born in San Diego, California in 1974. My parents moved up to Roseburg, Oregon when I was about 5. I basically was raised in Roseburg. Then went on to, after graduation from high school, I went on to Oregon State where I got my degree in general science. And then I went to the University of the Pacific Dental School in San Francisco where I earned my dental degree. I always knew that I wanted to come back and be a small town doc. And I had the opportunity to buy a practice back in my hometown. It had about 100 people in it, and I had 3 employees at the time. We remodeled the entire office. For the first 6 years, we continued growing at a nice steady rate. I acquired most of my practice management experience from my dental school, magazines, and other local dentists. While listening to a continuing education class one day, I heard Jay talking about the importance of answering the telephones. After listening to him critique a few of the offices and their phone calls, I realized that one of those offices could have been mine. I called right away and ordered the program.
The best thing I got out of the phone training is listening to yourself and being able to listen to other employees in the office and being able to critique yourself and break it down and know what you did wrong and what you did really good at, and that helps continue on the next conversation.
The importance of answering the telephone, it's really important to remember that that is the patient's first impression. Because a lot of patients don't just come in the door and say, hey, I would like to make an appointment. So 90%, I would say 90% of our patients' first impression is over the phone.
My staff became phone certified and we implemented the goals and bonus program. We saw an immediate increase in new patients and production. In the monthly CD, Jay introduced the concept of the Big 3. This increase in new patients would be the start of the constant balancing of the Big 3. It soon became obvious that we were running out of the space. It was time to move operations to a new building. The old practice was leveled to make room for a new retail development. We constructed our new office on a small hill that overlooked our old location. Construction of the new building was completed on December 31st, 2007. Our next area of focus was staff and training. With the new office and all the new patients, it was apparent that we needed additional staff. This is when we were first introduced to the Colby. The Colby process has been one of the most influential programs that the Scheduling Institute has introduced to us, not just in the workplace, but in my personal life as well. I use the Colby and Jay's hiring process to hire the right fit employee for the job. It allows me to assess each person and place them into the position that utilizes their natural abilities to their best. Colby has helped me be a better manager. By becoming a student of the Colby, it has allowed me to assign the right task to the proper staff member. It has helped us work more efficiently as a team and have a better understanding of our strengths and limitations. It has helped me notice my strengths and to hire people around me that compensate in areas that I do not excel. It has also made a huge difference in my personal life. I feel that the Colby is so important that I've had Mark Hamilton visit my office 3 times in the last 6 years. We've also had on-site trainings for the new patient experience and the conversion compliance programs.
The Scheduling Institute sent a patient in. They called the office, made an appointment. We were not aware of who the patient was going to be. They had a secret camera somewhere located on them so that with sound so they could hear what we talked about. They came in just like a regular new patient. We did all the exam, x-rays, everything we did for a regular new patient. After we had the secret shopper come in, the Scheduling Institute sent out a trainer to guide us through the new patient experience. At that time, they showed us the video, kind of went over things that we can improve on, things that we are doing right. They made some suggestions. The biggest thing that I've got from the experience was making sure that I'm consistent and accountable for everything that I'm doing with each patient. What we have implemented from the Scheduling Institute and the new patient experience is actually working, and patients are happy with the service that they're receiving in our office.
My assisting team has flown back to Atlanta and participated in the Assistant U.
It's a program that the Scheduling Institute has created for assistants to go there, and it kind of teaches them ways to make the practice better, more profitable. Increasing our production is one of their biggest things that they talk about, and strategies to do that. We've increased the amount of patients that we have, new patients. We've increased our production. We've become more efficient, better with communication. The Scheduling Institute has definitely made the practice grow.
Sherry has also flown out to our office to complete the on-site training for the hygiene program. Next, we increase our internal marketing efforts. We host a movie night 2 times a year where we invite randomly chosen patients to attend a private viewing at our local theater. One time a month, we hold a Patient Appreciation Day where the patients are rewarded for their loyalty by receiving a small gift as they arrive for their appointment. We also have a referral game that the patients get their name into a drawing when they refer a new patient to our office. Some of the prizes that we've given away included a 47-inch LED TV, an iPad, and a Traeger barbecue. The most important thing that I've learned from all of this is that it's not one big thing that brings in new patients. It's the multiple sources and constant evaluation that really makes the difference. As we began focusing on our external marketing, we worked hard to develop a brand for our practice. We had found that this is very successful. Not only have we seen a 100% increase in our monthly new patients, but we have also been voted the area's #1 dentist for the last 3 years by our local newspaper.
For external marketing strategies, we use the authority approach. It's another of Cialdini's 7 influences. We don't do in our newspaper and phone book and radio ads like come and see us for a deal. We do more informational, and we kind of focus on that more than just a drum up for new patients.
We've also implemented patient loyalty programs such as Whitening for Life and the Dr. Randall Club, which is a dental savings plan that we use for patients that do not have insurance. Increases in marketing and patient care have had a dramatic impact on our office. Production numbers and same-day treatment have increased. Despite the growth of our new business, our increase in efficiencies have given us more planning time and an appreciation of the value of time. I strongly believe that you must give back to your community. We started the Donated Dental Day event 11 years ago with the local dental society to help those without insurance or means to pay. We also contribute to the Wish Upon a Star program, make donations to our local schools and many other community charities and events, as well as donate dental services to our patients with special needs. In our first Platinum meeting, we worked hard on knowing what numbers we need to look at and why. We began calculating how much revenue each patient produces, the cost of advertising to acquire new patients, the number of new patients seen in a month, as well as other factors involving revenue. Knowing and staying on top of this hard data allows me to make clear and accurate decisions about office management instead of making guesses. Setting goals and reviewing them has also increased my engagement in my overall life. I've been able to focus more attention on my personal finances. I look at my net worth regularly. I've also set up my accounts and am making my daily transfers. I have also concentrated in reducing my debt. By using the Digi system, I really noticed my numbers going down, and it's kind of fun. I've listened to, read, attended, or participated in almost everything Jay and the Scheduling Institute has offered or suggested. I consider the time and money very well spent and would not be where I am today without their help. There are many things that I have learned from Jay and his staff, but if I could only name one concept that I value the most, it would be that of time. I worked 36 days less last year than before I started with the Scheduling Institute. That has allowed me to participate and spend more time with my family. I have the opportunity to coach my children's baseball, soccer, and basketball teams. I volunteer in each of their schools on Fridays. With 4 children under the age of 10, I really keep busy. I'm often the only dad at some of these events. I always feel lucky and blessed to be able to participate in these timeless moments. So, if I was fortunate enough to win the Lamborghini, I would try to leverage it as much as possible. First of all, it would probably be the only Lamborghini in Roseburg, Oregon. It would be something that I think I would drive from Atlanta back to Roseburg, stopping along all the milestones and taking pictures and putting it on Facebook and advertising it as much as possible. I'm sure that our local newspaper would do a story on it, on how a local dentist won this award and this prize. And what I would do after that is I would definitely sell the car, and the proceeds I would go to 2 different things. One would be as a thank you to my staff for all their hard work towards this program. I'd probably send them on a vacation to Hawaii or something like that. The second thing is we do a lot of giving back, and I think it would be something very appropriate to do with the rest of the money. I'm currently involved with a science camp for kids. It's a summer camp where they learn what a health professional is like. They go around to the offices, dental offices, vet offices in the hospital, and they learn what it would be to be a doctor or a dentist or a professional. And that's something that I think is very, very important. To get maximum mileage out of the car, what better way than to take those resources and invest them back into my community?